Okay. Let me welcome all of you to today's webinar. It's ISSUP Botswana webinar. And for today, we have a treat for you. We'll be having a presenter from Botswana presenting on the continuum of care in recovery. And our presenter for this session of the webinar is Ms. Odireleng Kasale. So I will take a few minutes to introduce who Ms. Odireleng is before we go on with our webinar. So before you even move forward, let me please give me this moment to just say out our webinar disclaimer. So please note that this webinar is provided for informational purposes only and does not constitute medical or treatment advice. The views presented here are those of the speaker and not necessarily those of ISSUP. So yes, I think we have to get that out of the way. And without further ado, I will now introduce to you your speaker of the day. So Ms. Odireleng Kasale, whose commitment to the field of recovery has culminated in her being in leadership roles, being the founder of a social impact enterprise called Sesha Recovery here in Botswana. And she's also the national coordinator for the Universal Recovery Curriculum and the country representative for the Global Mental Health Peer Network. Ms. Odireleng is also the Botswana coordinator for the Tough Love program. She did her UTC in November 2021, and she also did her UPC in August 2021. And additionally, she did the URC, that's Universal Recovery Curriculum for peer models, in September 2023. And currently, she's also adding to those by doing her women, her WISE course up to September. She's actively involved in setting up mutual aid groups, especially NA, in different parts of Botswana. And in her spare time, she enjoys reading and writing. So, ladies and gentlemen, she has also been featured in 2 World Health Organization publications, one being the Intention of Action series, that is the people's perspective from individuals with lived experiences of non-communicable diseases, mental health care conditions, and neurological conditions, and also the World Mental Health Report in the lived experience narrative. So she's a very committed lady who has done a lot in the field of recovery, and she will continue to do more as today she presents today's webinar. Let me welcome Ms. Odireleng to the stage.
Thank you, Waja, for the introduction. Today, my name is Odireleng, as my colleague Waja has already introduced me. And today I'm going to be presenting on the continuum of care in recovery. So we'll just start off by, I'll just share with you what recovery is. Recovery is a lifelong process. It's not just treatment or going through one phase of treatment and then you stop. It's a lifelong process, and everyone's recovery journey is unique. This is to say that everybody's journey of how they feel that they're going to be in recovery is unique. There's no wrong or right way of recovering, and recovery includes many changes beyond the physical, including changes in attitudes, beliefs, and values. So recovery is beyond what you see on the outside, but it involves a lot of shift in perspectives, in attitudes, in beliefs, and value systems as well. And recovery is made possible through mutual sharing, respect, connection, and appreciation of diversity. In recovery, we meet people from different backgrounds, and in sharing experiences, that's where most of the healing happens, when people come out and not having to hide in the dark anymore. And recovery and treatment are not the same. Recovery is one component and treatment is one component. They're not the same thing. So a bit of background on what continuum of care is, especially in the context of recovery, so that we know that a substance use disorder is a chronic brain disease, often marked with recurrence of use or relapse, as most of us know it. So a continuum of care provides for the potential need for individuals to re-enter care along the continuum. So this basically means that at any point, at any level of the care that a client may need to go back to re-enter a service or a level of care, they go back to that care. If a client needs outpatient, they might need to re-enter outpatient because they're struggling with a few elements in their recovery. So treating substance use disorders is complex and it involves interventions at different levels to ensure a person is able to maintain long-term recovery. So there's no one way of treating it. You just don't treat it and then it ends. It involves different interventions to address the different needs that an individual or a client may present with. A continuum of care is a detailed plan of what services a person needs to help him or her maintain long-term recovery after seeking treatment. So there's an array of services that a person may need to address the different problems they come in treatment presenting with. So in order to maintain long-term recovery, the continuum of care has to have a detailed plan of what those services will look like and what the client will need to access the services. And in a system where clients are guided, monitored over time as they progress through all levels and intensities of care. In some cases, this approach may be referred to as a recovery-oriented system of care. A full continuum of care provides patients with the best form of treatment to maintain long-term recovery. And an inpatient treatment program often provides the right starting point for recovery for most people. So a continuum of care that has all the different levels of care will provide the best form of treatment that will ensure that a client is not only engaged in treatment, but is also able to sustain that journey in recovery, because recovery is a lifelong process. And no matter which stage of change a person is in a structured continuum of care, it will guide them through every step, helping build a solid foundation for lasting healing and transformation in recovery. So when a client enters treatment, regardless of which stage of change they may be in pre-contemplation or contemplation, whatever the case may be, continuum of care is structured. It will guide the client through every step to ensure that they are right interventions and services to be able to build a solid foundation, and this will ultimately contribute to a sustainable recovery. As a continuum of care system that meets the individual with the level of care they need for that specific situation is important because each person's substance use disorder is unique, and the scope of treatment is necessary for the recovery will be different from another person. So just as there are different pathways to recovery and everybody's recovery journey is different, when a client comes into treatment, they also have unique, the needs are unique, and depending on their needs, which needs need to be addressed, that will determine what kind of treatment that they will need. So they're not the same, they differ from person to person. And it involves understanding that attainment of therapeutic results transcends the limits of a specific setting, which requires the person's transit through an articulated care of network. So the network of the continuum of care has to be well coordinated and has to work well together for the client or for an individual to benefit from the network or from the continuum of care. So these are the different levels of care that an individual can come into. This is the different levels of care that an individual can come into when they start that continuum of care, when they decide that they have a substance use disorder that needs to be addressed and they start seeking help. This is what the different levels of care usually look like. So we'll start with the assessment, because usually this is the starting point, the screening and the assessment. So a screening is administered by using a validated tool. There are different tools that are used to screen for a substance use disorder and to determine the level of risk that an individual may represent. So the first point is to screen them, to assess and to gauge the extent of use, to determine first of all what substance they're using, the extent of use of that substance. And then thereafter an assessment is done to determine the severity and the urgency of the client's problems. How has it affected the different areas of their lives, the financial, the family, work-wise. So all of this is done to gather information which will later inform the different levels of care in the continuum of care for an individual or for a client. And then thereafter, an individualized treatment planner is devised. So there are 2 steps in treatment planning, which are both a collaborative effort between the client and the person helping. So the first step is developing it, and then the second step is implementation. So in developing an individualized treatment planner, where the client's needs are derived and essential steps of arriving at those needs are detailed for the course of treatment. So this is the first stage, the first step after the assessment. You develop a treatment planner to establish and lay the foundation that these are the client's needs, that this is what the client is presenting with, and these are the steps that are going to be taken for the course of treatment. And then after developing the treatment planner, there's the implementation of the individualized treatment plan. So you then systematically carry out a series of interventions to help the client achieve the goals of the treatment planner. So for every need, a goal is set, and then as an intervention is put forth to address that need and to be able to achieve that goal. So the treatment plan should be monitored on an ongoing basis in order to assess compliance and identify in a timely manner the need for modifications, reformulations, or updates. So it's very imperative that the treatment plan is monitored to ensure that the client is adhering to the interventions that have been provided to meet the needs and to ensure that the overall goals are met. Compliance is very important. And then monitoring also helps identify in a timely manner the need for modifications. So if there's something that's not working, if a treatment planner is monitored properly, then you are able to then identify that, okay, this is not working. Where can we modify it in order to meet the needs of the client and for enable them to ultimately meet their treatment goals? So after the treatment planner, the other level of care in the continuum of care is outpatient care. So the outpatient care offered in a variety of locations. You can find them in public or private health centers. You can find them in hospital, clinics, and many other settings. And outpatient cares provide services in schedules that are adjusted to and do not interfere with the school or work activities of the people they serve. So what will happen is that you schedule a time that will ensure that the person that you are helping or the individual that you are helping is still able to continue with their daily activities, but making time to be able to attend the session, the one-on-one session, counseling session, or psychoeducation session, by being mindful of their schedule so that you do not take them out too much of their daily schedules, so that they have a routine in place and it works for both you as the person helping and the individual who's getting help. And then we have the inpatient care, which is a therapeutic setting which has been designed to provide protected environment for the person to be separated from chaotic and stressful environment. So depending on what was derived from the screening and the assessment, some individuals may need a more intensive setting where you remove them completely from the environment in order to address the substance use disorder, because it will be more beneficial for that. So in those circumstances, an individual would be admitted in an inpatient care, which is a therapeutic setting, which caters for the different needs that they come in presenting with when they come into the treatment facility. So admission to the treatment program usually requires accepting the treatment setting norms and regulations. So a treatment facility will have norms and regulations or rules and guidelines that an individual will have to adhere to be able to complete the program. The program can be 30 days, 60 days, depending on the severity and the resources that are available to the individual to be able to pay for the facility. And then the last level of care in the continuum of care is the aftercare, and this is where most recovery support services are offered. So in the aftercare focuses on reducing the risk of return to substance use by offering comprehensive recovery support services. So this is where usually most of the work now begins, because this is now when a person is introduced or reintegrated into society as a person who will be abstaining completely from substance use. And this is where the journey of recovery usually begins. And the primary goal of aftercare or recovery management is to maintain benefits obtained in other levels of care by providing continuous support individualized to the patient's needs. So this, the primary goal of this is to, from the different levels of care that the client or the individual has been through, now they have to take that foundation and use it to now begin their journey in recovery. But they'll still need continuous support to address the different individual needs that they may present with. And it is often referred to as the cornerstone of the continuum of care in recovery, because that's where most of the work is done, and that's where the real work is done. The real work begins for an individual or for a client. These are some of the elements that an effective aftercare program has. So the first one is a sober living home. So a sober living home sober living homes help provide a smooth transition from inpatient or outpatient treatment to everyday life. There are chores, visitations, curfews, and participation in 12-step meetings. These elements come together to create an environment that helps maintain long-term recovery. So when an individual is discharged from an inpatient facility or is discharged for an intensive outpatient treatment facility, they usually transition to a sober living home, just so that they live with people who have the same values and who have the same goal of living without substance use, just to encourage each other and just to be in the routine, a similar routine that they were in, especially from an inpatient. It's a step down. It's a step down that can help an individual adjust and still maintain what was instilled and what was taught in inpatient before being released to be independent. So it really creates an environment that helps maintain long-term recovery in that regard. Another element of an effective aftercare program is joining support group meetings. So in support group meetings, it's a place for individuals to connect with others in recovery, talk about their struggles, and learn new coping skills. And participation in meetings helps individuals remain motivated and accountable during their recovery journey. So joining a support group meeting just helps an individual associate and interact with people who have similar outlooks and similar goals in life, and it helps them to cope better, because with a goal in mind to live a life that is abstinent from any substance use or any mind altering substances. Another effective element of an effective aftercare program is participation in alumni programs. So alumni programs can help individuals maintain recovery by connecting them to broader network of participants, practitioners, and community-based activities, and help build a recovery communities. So a person can find purpose, if a person can find community in a program that they once benefited from. So whether it's an inpatient program or an outpatient program, if a facility offers an alumni program, it offers individuals to always go back and rekindle and reconnect with the place where their healing journey or their recovery journey began with. And it always gives them a sense of purpose and a sense to keep going by having that network of people who know and how difficult recovery is, but keep encouraging them. And that connection can really keep the fire of recovery burning. And continuing with medical and mental health care is very important as well. Medical professionals can help monitor physical and mental health and address any conditions that may hinder growth in an individual's recovery. So if an individual continuously goes back to medical professionals and people who can help with the mental health, that support can monitor how they're doing in those two aspects and make sure that there's nothing that, or there's no condition or anything that may hinder that growth in that recovery, because recovery is a holistic journey. It involves different components, and the mental and physical are part of those things that recovery involves. The wellness of those components is very important in an individual's recovery journey. And then getting a sponsor. So upon the discharge, or especially in inpatient facilities, it's encouraged, and the counselors always encourage that before being discharged, an individual has a sponsor that they will be working with. A sponsor is someone who has been in recovery for a certain amount of time, usually more than 1 year, and can provide guidance, support, and accountability to a person who's still in their early recoveries or still in their early days. So they provide support and guidance and accountability by introducing an individual to other members in the 12-step program when they attend meetings together and they listen to other people who have been able to be in recovery for a long time and who have been able to persevere just by working the program and working the 12 steps. And they offer support as needed. They usually have check-ins, or they have daily where a sponsee checks in daily with their inventory or whatever the case may be. And then they explain the 12-step to the loved ones of the individual who's new in recovery, just so that the family or the loved ones are also able to understand and support accordingly, knowing what exactly are they supporting their loved one in. And then ongoing therapy is very important as well after treatment, so whether it's inpatient or outpatient, individuals face challenges or triggers. So when you are in treatment and you are discharged, it doesn't mean now your substance use disorder finishes or your challenges finishes. And individuals continue to face challenges. And those are the early days in recovery where people really, really need a lot of support. So ongoing therapy is encouraged, and it can help address any unresolved issues or help develop better coping mechanism, help develop healthy coping mechanisms while reintegrating into society as a person in recovery. So the therapy will help. It will really be an anchor over and above the sponsor. It will anchor the person as they navigate and maneuver this new way of living. And outpatient programs can take various forms, like counseling sessions, one-on-one counseling sessions. Group therapy has proven to be a very effective approach in recovery and in addressing substance use disorders. And then 12-step or CB2 workshops or activities such as gardening and yoga, just to instill and really solidify this new way of life that an individual will be taking in that recovery journey. And then getting support from friends and family. So family have an important role in helping a loved one sustain their long-term recovery. Treatment programs often encourage families to participate in therapy or counseling sessions during and after treatment, because family helps individuals practice healthy habits and adjust to life outside treatment. So while the individual is addressing their substance use disorder and getting help for their substance use disorder, it is encouraged that the family as well enroll in a family program, to ensure that they also get the tools and techniques of how they're going to support their loved one once they're discharged, and how they will help create an environment that is fertile and that is supportive to grow the person in their recovery. So that what different things in that treatment programs, or like setting boundaries and how to really take care and deal with a person who is in recovery. So it's very important. It's imperative that families participate in some form of therapy or counseling or some form of program as well, as the loved one also gets help for their substance use disorder. This will ultimately help both parties once the loved one is discharged and now begins their journey in recovery, and as they are reintegrated into society. So recovery support services as part of a continuum of care in recovery. There are strategies that support recovery, and there are less intensive levels of care as a client steps down in the continuum of care and assist individuals sustain their recovery. So in the diagram, the diagram that I projected earlier, usually these are at the end. They fall under the aftercare. Recovery support services fall under the aftercare, and that usually the last level that an individual or a client will transition to. So you'll notice that with each level of care, it's like stepping down to a less intensive. So the recovery support services are usually the last, and they are the ones that now usher an individual into their new life and to their new way of living. So as much as they are not intensive as the initial stages, they require, adherence, and they require a commitment, because they're lifelong. It's a lifelong process. Your life is now beginning, or an individual's life is now beginning as a person in long-term recovery. So long-term consistent peer support relationships are established and guide recovery. In the case of a sponsor is a peer in recovery. So those kind of relationships are very, very important, and they're usually established in support group meetings and 12-step meetings, and they guide a person in recovery, because you usually have people who have been in recovery for a longer time, and they're able to guide the person who's new in that recovery or who's stepping down from a level of care such as outpatient or inpatient, to be able to show them how they'll be able to grow in this journey of recovery. And individuals are engaged in developing goals and recovery plans. These are some of the activities that people do in as part of the recovery support services that will be offered. They now have life goals that initially in the treatment planning stage is goals that will address the substance use, but as time goes on now, they'll have different goals of how they're going to be rebuilding their lives and getting back their lives back in order. So it's very important that an individual is engaged in this process, because at the end of the day, these goals are theirs to achieve. As a person help, you just facilitate the process. And then they help assess and grow recovery capital to support long-term recovery management. So they assess and grow the resources that are available to the client and the community in their social life. They assess those resources and see how they can support an individual to grow those resources, and how they can support the individual in their recovery journey. And then they support self-directed knowledge of multiple pathways. There are different pathways to recovery. So the recovery support services, they'll support, they'll give information, and they'll support the client in exploring for themselves what pathway works for me, and what is it that a person resonates with and that they would like to take on as a pathway or as a path for their healing journey or their recovery journey. And they also provide skill building opportunities. So why is it important? Why is the continuum of care important, specifically at the recovery stage? Why is it important? Ongoing recovery checkups are held to review recovery plans. So monitoring of ongoing recovery checkups helps to review recovery plans, celebrate progress, and adjust to accommodate new ideas to support recovery growth. So they're important because they monitor all these processes through in checkups. You monitor the recovery plans, you monitor milestones are very, very important for somebody who's going in or who's in recovery, whether it's 2 months, whether it's 10 years, whether 12 years. Every day is a miracle. It's a just for today journey. So every day in recovery is a miracle. So you celebrate the progress that they make. There are different ways of celebrating. You can give tags, you can give outside the 12-step meetings. As a person helping a person an individual in recovery, there's a way you can celebrate their progress and adjust to accommodate new ideas to support recovery growth. So as they grow, when you monitor progress, as they grow new ideas, as they have new ideas and and they're growing, you accommodate those new ideas to support their recovery growth, so that they also don't feel stuck or stagnant, and they feel that they're really growing in their recovery journey. And recovery planning across 10 domains, it links individuals to resources in the community that will help them grow in their recovery. And then recovery support services that can be offered in the continuum of care. So they can be information and referral. They can be peer-to-peer support. They can be recovery coaching. They can be return to use prevention programs. They can be self-help and support groups, and substance abuse education in the form of psycho-education sessions. That can be part of the aftercare program. And then there can be transportation as part of supporting the person who's new in recovery. A sponsor or a recovery coach can commit to taking them to recovery support activities or 12-step meetings, or to drop off CVs and job applications, just a way of supporting that recovery. And there can be aftercare services. There can be alcohol and drug-free social activities, just as a way to avoid things that might trigger a return to use or that might trigger a relapse. And then there's also case management services, and there's also childcare. Now, employment services, HIV or AIDS services and education, and housing and support, and transitional housing services. So these are just some of the recovery support services that a Continuum of Care can have in place, especially at the aftercare level of care. And text here in Botswana, what do we have in place? So currently our recovery community is still not very visible. It's still in its infancy stages, but we do have recovery support groups that an individual can be referred to, and there are self-help groups. We have 2 NA meetings and 3 Alcoholics Anonymous meetings. And then different outpatient settings have return to use prevention programs where individuals are monitored for any triggers or any stressful events that might trigger a return to use, and they're supported accordingly to avoid such. And then areas we need to improve, or what do we need to be improved? As I mentioned, our recovery field is still in its infancy. It's in its infancy. So services tend to be scattered or difficult to access. And then there is also no inpatient facility. There's a psychiatric hospital where most people are sent to, but then when they're discharged, the challenge then becomes that because the services are scattered, it's very hard for one to maintain their recoveries because the services are not well placed and well coordinated currently. Especially recovery support services, there are very few and they're scattered, so it becomes a challenge when that is discharged from an inpatient, the psychiatric hospital. So the other challenge is that there is no inpatient treatment facility that specifically deals with and addresses substance use disorders. And there are few intensive outpatient services. And then there's not enough peer support on the ground. So there's, the community is still very small, and it limits people when they are now starting their recovery journey or in the early recovery, or as to where they can go for support. It's growing and it's promising, but still not sufficient enough to support the people who are seeking or who are new in recovery. And support needs to be individualized, meeting people where they are as they present with different needs to maintain their recovery. Because of the scattered services, that means that people have very few options as to where they can go when they're starting their journey or when they're ready to begin their journey of recovery. So there's a need for more individualized programs especially that are more specific to supporting recovery. Having interventions that specifically address that, as we saw in the previous slides, that an effective aftercare program has to have certain elements. So I think that's our biggest challenge currently on the ground, that we lack such a program for that level of care in recovery. And then stigma continues to hinder a lot of people from getting help. People who are in recovery also go through stigma. It's not celebrated as much as it could be. And I think that's why our recovery community is not visible, because some people recover in their little corners because they fear that recovering out loud comes with a lot of stigma and judgment. So people do find healing, but they choose to keep it in their corners because of fear of judgment, because of the stigma that continues to surround issues of substance use disorders. And supporting staff, and because there's few services and are scattered, and few people who are trained in the field of recovery, a lot of people suffer from burnout and self-care. Burnout and self-care are critical concerns because there's a huge there's a lot of people struggling with substance use disorders, but because of the few resources that we are having to work with, people find themselves having to overwork themselves, and this can lead to burnout and lack of self-care. So these have become critical concerns, and there's also the need to acknowledge that recovery is a process, and it requires time and planning to integrate it into systems. So in a recovery orientated approach, or in a recovery oriented system of care, will take time to embed into the already existing systems that are already there, and seeing how we can navigate to disperse as much recovery support services as possible and recovery support professionals as possible to be able to go out there and help people, and combine experience and structure. Sharing lived experience combined with structured skill building can provide the missing piece for many struggling to sustain long-term recovery. It's sharing your story and sharing your lived experience is very important, but it's also important now to teach the skill and to teach the tools and the techniques that are at the core and at the foundation of sustaining long-term recovery. And I think that's why it's important it's very important to roll out training for people who are in long-term recovery and want to go out there and help other people. It's very important to build capacity and ensure that when they do go out there and help other people, they're using evidence-based practices and are doing good, because sometimes helping, you can do more harm than good. So it's very imperative to build capacity and ensure that evidence-based practices are being used by peers who are supporting or recovery support professionals who are trying to help by using their lived experience. It's important to share our stories, but it's also important to afford those who are seeking recovery the right and adequate care that will help them sustain a long-term recovery. And I have come to the end of the presentation. Waja?
Hey, thank you very much, Ms. Dira, for that very informative presentation. It was a lot, it was quite a lot, and I think you did a brilliant job in going through, presenting it through and explaining the concepts as you were going. So I would like to take this moment to officially thank you for the presentation.
Thank you, Waja.
Now, all right. Now, we have come to the next part of the webinar, where we will now go for the Q&A, questions and answers. My apologies, I should have mentioned at the beginning of the session that we will be taking questions through the chat throughout the presentation, but I do see a few questions that came through. So I will encourage those who would like to ask something to please put it down on the question and answer section there, so that we may address them accordingly. Okay, now on to the questions. I do have a few questions here, Ms. Dire. Starting with one question from Stephen Giraga in Uganda. Okay, I'll just read through the message. It says, greetings, thank you for the presentation, it's insightful. How does one handle a situation of a recovering person backsliding? So that's the one question. How does one handle a situation of a recovering person backsliding? And then
Okay.
another question is says, some programs do not have sober living homes. What would you recommend? So some programs do not have sober living homes. So what would you recommend? So I will take those first two questions and then allow you. So the second question that was from Esther Hazard. I don't know where she's from.
So
Please take those two.
I'll start with. Okay, thank you, Waja. I'll start with Stephen's question. How do you handle a person who's in recovery, who is backsliding, or who is having episodes of recurrence of use? So part of the recovery journey is that a person might have a recurrence of use or a return to use, and that's why as part of an aftercare, the level of care at aftercare level, there has to be some form of return to use prevention program or a program in place for a relapse prevention program that will address the person's challenges or the person's needs, because quite often you'll find that there's something that is not working in one area of their life that is causing it might be a stressful situation, and it's causing them to have this unhealthy coping mechanism of keep going back to substance use. So in that case, depending on what you have in your community or what you have in your context, you take the person back to a facility, and if they have a relapse prevention program, you enroll them in that program. In the program, I believe they can do a screening and an assessment to really establish what is the challenge with the person that keeps causing them to return to use, even though they have been through a treatment program. I believe the person might have gone through a treatment program, but they keep having the episodes where they return to use. So that is how I believe it can be addressed, Mr. Stephen in Uganda. And then for Ms. Esther, for living homes, in contexts that don't have living homes, what is recommended, as is the case in our context, there are no sober living homes. So you evaluate the services that are available in your community. What is there that can support the person's recovery? Some people are able to start their journey of recovery in the 12-step programs and are able to sustain them. So maybe family members of that person can be encouraged to, learn about 12-step programs and take that person to 12-step programs. And then if they are, depending on what, it really depends. If there are no sober living homes, it really depends. What do you have in your environment that can support the recovery of the person?
Okay. Thank you. A follow-up question that I think can be connected to those ones. I'll pick one from Raimundo Paxson. Says, how long aftercare program?
How?
And how long is the aftercare program? That's from Raimundo.
Okay.
And then
And after
question. Yes, I think let me give you these two. Another question says, it is said that recovery is voluntary and non-voluntary. Do you agree? That's also from Esther Hazard.
Okay.
Yes, let's take those.
I'll start with Ray's question. How long is an aftercare program? It can range from anything from 6 to 12 weeks, depending on the needs of the client when they step down, because at every level they're stepping down either from inpatient. So if they're coming from an inpatient care and there's no sober living home, the aftercare program might have to be intensive to accommodate the need of the individual and to accommodate for the fact that they're now being reintegrated into society. society as a person who's abstaining from substances, and that can be quite difficult. So depending on where they are when they step into the aftercare program, it can range from anything from 6 to 12 weeks. Another factor that contributes to the length of the aftercare program is how long they were in the previous program that they're stepping down from, and so forth. So it really depends on the needs of the clients that will contribute to the length of stay in that program. But besides that, they're going to have other things aftercare are going to be lifelong. For instance, going for support group meeting, form of support group meetings, but some form of recovery program group is encouraged for the first year in recovery, so that the client is really immersed in the principles of recovery. I don't know if that's okay. And then recovery being voluntary and non-voluntary. I think the recovery, I believe that the recovery journey starts with acceptance that there's a problem. So when an individual accepts that they have a problem with substance use disorder, that makes it voluntary. You are accepting and you are surrendering that you can't go on living like this, and you are now beginning your journey of recovery. But obviously you start first with treatment, and then you take it from there. So I believe recovery is voluntary in that essence, because it has to come from you for it to be lifelong and sustainable, and to be able to maintain. A person has to accept, it has to come from them, not a family member, not a loved one, but themselves deciding that I can't live like this anymore. Okay.
All right. I will take the last two questions, and then we will go through the end of our webinar. I see a question again from Esther Hazard, saying, what can we do to reduce stigma in recovery?
Okay, so I think the biggest lesson from being a recovery specialist, what I have observed for working in the field, is that when people learn and equip themselves with the knowledge, then the stigma and the preconceived ideas and the misconceptions automatically fade away. Knowledge is a very powerful thing. Once you replace that with myths and things that you hear and things that you perceive, you make way with for the information that you will now be accepting is what it really is. So I believe what can counter stigma is, education and awareness, like really teaching people about recovery and what recovery is, what recovery is not, and how do you support a person in recovery, because it's a lifelong journey. So to beat stigma, we can just up the information, the dispersion of information, teaching people about recovery, especially families and communities that people will be reintegrated to. Okay.
Okay. Because that was one question I said two, but it's fine. I will take just one more. Okay. Apologies to the listeners. I'll take one question from Sehola Mikaela here. It says, it seems like the 12-step meetings are Christian-based. Don't you think we are perhaps imposing Christianity beliefs into our clients?
Okay, so now 12-step programs are spiritual, but they're not religious. There's an emphasis that's put on that to make sure that people are not scared away by the fact that they might feel that a religion is being imposed on them. So there are spiritual principles that an individual is taken through when they work the 12-step program. So they're not religious, but rather spiritual. There are 12-step models that are spiritual, that are faith-based, to accommodate for those people who feel that they would benefit from a religious approach in treating their substance use disorder or starting their recovery journey. But 12-step programs are not religious. That is very specific. They're spiritual and they're not religious.
All right. Thank you very much, Dira. I think that would end our round of questions at this point. I will just read through a couple of other comments we've had here, just to appreciate them. There is one from Professor Krishna. Professor Krishna is just some support, best regards to the organizer and the respected galaxy of panelists. We are engaged in forensic social work voluntarily. And she goes on to say it's a brilliant presentation, and also commenting that severe mental illness through we care, drug-induced severe mental illness through or we cure, I think. I'm not sure what that is. Through counseling, group discussion, games and sports, swimming, gardening, and finally stay safe. Stay safe naturally, prevention, treatment, recovery, and management. Yes, and it says thank you. And we have other people who are basically just saying thank yous. I can't read all of them, it's quite a bit, but we recognize all of your comments and we appreciate all of them. And thank you for attending this session of our ISSUP Botswana webinar. We are very much grateful, and we hope that we have learned a thing or two, and we hope that we managed to answer most of your questions. And we would be very much grateful if you attend our next webinars. Let me finally announce that this webinar will be shared on the ISSUP YouTube page. It will be uploaded, and as well there will be certificates of attendance which will be sent to you to your emails in the next 24 hours. So that with those few words, we have come to the end of our webinar. Let me thank the participant. Let me thank the panelists, the presenter here, as well as the staff in the background, Ms. Olivia and Radolf. So thank you very much. Thank you for attending. We've come to the end of our session, and goodbye.
Thank you.